The new Part D drug coverage plan options for 2025 became public on October 1st, but you can't sign up for the new plans until October 15th, which is the day that I'm making this video, and it marks the start of the annual enrollment period. I waited to make this video on October 15th because you'll now be able to go from start to finish, putting in your medications, picking your preferred pharmacies, seeing your 2025 costs, and as of today, you can actually sign up and enroll in the plan that works best for you. I also have some important tips on how to make sure you don't make some serious mistakes while using Medicare.gov and picking your Part D plan. You can do this along with me. I've been told I speak quickly, so I will go slower than normal, and you can pause at any point along the way. Finally, before we get started, if you are on a Medicare Advantage plan, do not go through this process. If you sign up for a standalone drug plan while you're on your Advantage plan, it will cancel your Advantage plan, and if you're not already approved for a supplement plan, this can cause some serious problems. So if you're trying to switch from Advantage to supplement and a drug plan, stop. Connect with your agent or broker because there is a specific order to doing that. Okay, for those who are already on a standalone drug plan, there are two ways that you can do this. The first is if you already have a Medicare.gov account. I highly recommend that you get a Medicare.gov account if you don't have one already. It makes all of this very easy, and with your account, you can see an itemized breakdown of all of your Medicare costs as they come up. Not just prescriptions, but hospital and medical costs as well. So I'll cover that option first. You have a Medicare.gov account. The second option is if you do not have a Medicare.gov account, you can still see and do everything that I'll show you in this video, including getting signed up, but it's a little bit more involved. You can skip using the chapters in this video to whichever suits you best. Now we'll start with those of you who do have a Medicare.gov account with relatively low cost medications. The second part will have higher cost medications. Okay, those with a Medicare.gov account, watch how easy this is. Open up your internet browser. I'm using Chrome. I'm in an incognito window because I don't want everything auto-filling with information. Go to Medicare.gov. And in the upper right-hand corner, there is a login button. Click that. In this left box here is where you will put in your username and your password. Medicare.gov usually makes you set up what is called two-factor authentication. So when you put in your password, it will send you a text message or maybe an email, and you need to put in the code that is sent to you here. Once you've got all that done, you're now in your Medicare account homepage. From here, you're going to click the Find Health and Drugs Plans. That's funny. I think that's a mistake. So they may have fixed this by the time you watch this. So click on Find Health and Drug Plans. Next, it will auto-populate with your current drug plan and costs. The reason going through your Medicare account is easier is because it's auto-populating your existing medications. You don't have to type anything in. It is pulling the data from your pharmacy claims. Now, sometimes it is pulling in medications that you were taking but you no longer have to take. So if you scroll down, you can edit your drug list if this is incorrect, including removing medications or adding new prescriptions. We'll scroll back up to the top. Off to the right, click the Find Plans Now button. Choose 2025 and put in your zip code, then click Continue. Next, this is a Medicare drug plan tutorial, so click on the Medicare Drug Plan Part D button and click Find Plans. They make this pretty easy. At the very top is your existing plan and what that will look like for 2025. As you scroll down, it will show you other plans, and this is important. There is a Sort Plans By dropdown here. Keep this at lowest drug plus premium cost. Do not change this. This is how you want it sorted to show you the plans with the lowest overall cost to you. Now, notice that the lowest overall cost plan in this example is our current 2024 plan. If your current plan is still the lowest cost option for you in 2025, you're done. You don't need to do anything further. Your plan will automatically renew for 2025, and you can relax. You can see that it won't let you re-sign up for your existing plan. This is all done for you. If we scroll down further, the next lowest cost plan is here. It is about $80 more for the year than the other plan. But if the lowest cost plan is a plan that you are not on for 2024, meaning your current plan is experiencing a big increase, or maybe there are other lower cost plans for you, you would click the Enroll button here. That would take you through everything that you would need to do to get signed up. A screen pops up asking you to confirm that you want to make this switch, and it's super easy. I'm logged into a family member's account here, so I'm not going to go past this spot and sign them up for something that we shouldn't. Once you finish that enrollment process, you are done. Your new plan will begin on January 1st, 2025. You will receive your new plan documents before January 1st via mail or email or possibly both. Super easy here. I'm going to move on to those who do not have a Medicare.gov account, but there are some very useful tips in this next part, even for those who do have a Medicare.gov account that I didn't cover yet. So just skip in the chapters that says comparing plans, and that'll get you to some extra tips. Okay, now let's go over if you do not have a Medicare.gov account, and we'll throw in some higher cost medications into this one. Your first step is the same. Open an internet browser. I use Chrome in incognito mode for this video and go to Medicare.gov. You're going to want to find the health and drug plans option in the upper right portion of the screen. Click it once and it will open the drop-down menu. Over to the left under the Find and Compare, you want to click the Find Health and Drug Plans button. Over on this right side, make sure 2025 is selected because we are looking at 2025 plans. Put in your zip code. Our family went on a big road trip this year and the kids' favorite spot was Disney World in Orlando, Florida, so that is the zip code that we'll use, 32830. Click the Continue button. We are going to choose the Medicare Drug Plan Part D option and click Find Plans. This next part asks if you are getting any help with your Medicare health or drug costs. This is specifically referring to official government programs designed for those with low incomes. This does not mean that you have a friend or a family member helping you out. If you want to know more about what each of these programs are, you can click this little information button and it will open a sidebar explaining each of the programs. I'm going to click the I don't get any help from any of these programs option and then click the green Continue button. The next screen is asking if you want to see your drug costs when we compare the plans, and we absolutely want to see the drug costs, so click Yes, and then the green Next button. Now you're going to enter your medications. A quick search tip here is that less is more. If you type out your entire medication name, it opens the door for misspellings and issues finding your medication. So if I'm looking for atorvastatin, I'm not going to type in the full name. I'll start with ATOR, and it shows up on the list, and I'll click it. Then click Add Drug. It's going to ask about your dosage, quantity, and frequency. Make sure you put in the accurate information here because if you don't, it completely throws off the costs and which plan would be best for you. Your prescription bottle or tags that come on your medications will have most of this. If not, your pharmacy can help. Once you have that in there, click the green Add to My Drug List button. If you have more medications, click the Add Another Drug button. I'm going to add in several very high-cost drugs just to point out some important aspects of the 2025 drug changes. This is not necessarily an accurate depiction of a real-life person. I'm just throwing in some high-cost common drugs here, so if we have a pharmacist watching and freaking out because these drugs interact poorly with each other, this is just to get high-cost meds in here. Lantus is for insulin for those with diabetes. Diflorazone is a cream to treat skin conditions like psoriasis. Symbicort is an inhaler for asthma and COPD. Notice that with this one, it asks us if I want to look at a generic alternative. Generics will cost less, but we're going to use the brand for this example. Eliquis is to prevent blood clots, and Xarelto is another blood thinner to prevent blood clots. All of these have very specific dosages, packaging options, and frequency aspects that you have to get right, or it'll throw everything off. Things like tablets versus capsules versus extended release or ER versions matter. Double check on creams or ointments and how often you need refills. Okay, you can pause here if you are still adding medications for yourself. Once you have all of your prescriptions in there, click the Done Adding Drugs button. Now you can pick up to 5 pharmacies. I always check mail order. I highly recommend you pick 3 different pharmacies, and I mean different brands of pharmacy. Even if you really like Walgreens, don't pick 3 Walgreens locations. Pick Walgreens and then a different brand like CVS or any other local pharmacy that you like. Click the box next to the pharmacies that you want. If you don't see your preferred pharmacy, there are multiple pages that you can search through, or maybe you need to change this drop-down to be a larger area rather than 5 miles. Or you can type in your pharmacy name in the search field. Add at least 3 and up to 5 pharmacies, including mail order, and once you have your preferred pharmacy selected, along the bottom there is a white button that says Done. Click that. Here's where the fun happens. The next screen will have all of the Part D plans available in your area, and it is already sorted by lowest drug and premium costs. Keep it sorted like this. Don't change this drop-down because you really do want the lowest overall cost to you. A big mistake people make is they look at the premium cost and they want the plan with the lowest premiums, but the plan with the lowest premiums, as I'll show you, isn't always the lowest overall cost to you. Now, there are a couple of things that we need to notice in this example. First, notice how the total costs for you with these medications are well over the $2,000 max out of pocket everyone has been talking about for the last year, and how great that will be for folks with high cost medications. Well, we can see that not everyone has a $2,000 cap, and there is an important reason. You can click on the Plan Details button to see what's going on. Then click on the Drug Coverage tab. Notice that the pharmacies are all network pharmacies, but when we get down to the drug costs, we see that the diflurazone cream is not on formulary. I think I set the frequency of this to be a tube every month as well, which would be a lot. In other videos, I've discussed how important formularies and tiers are. If a medication or brand is not on your drug plan's formulary, number one, you are paying for the cost of that out of pocket, and number two, that dollar amount does not count towards your $2,000 max out of pocket limit for drug coverage in 2025. So you could see higher than $2,000 in out of pocket medication costs even in 2025. In this case, you'd want to work with your doctor to find a similar medication that would be on formulary for you. Okay, I'm going to go back and remove that just so that we have an example where all of the medications are on formulary, and I'll show you something else. You can go back and edit your entries. I'm going to go back to the drug list and I'm deleting the diflurazone cream. If you forgot a medication, you can always get back to here and add another medication. Okay, now we see our total cost on the lowest plan available is under $2,000. If you had this drug list and you lived in this zip code, here's the plan you would get. I may take some heat for this, but the star rating with drug plans isn't nearly as important as it is with Advantage plans, but that's for another video. All right, this plan has a $92.20 premium. You are paying this each month just to have the plan. Remember the first example, the premium was $0? Well, what's going on here? Let's look at the plan details of this $92 premium plan, and then we'll find that $0 plan and compare. All of the pharmacies are still in network. Next section is the yearly cost by pharmacy, where you can see that the pharmacy that you pick does make a difference. And then the next section is my favorite. It shows you your estimated cost in each month of the year. You can see that you're hitting your max drug costs in April with CVS and mail order, and then May with Walgreens and Publix. Now I'm going to go back and find the $0 premium plan to show you why it's so important that you keep this filter on lowest drug plus premium cost, not lowest monthly premium cost. You can compare different plans by clicking this little Add to Compare box. I'm going to change this to lowest monthly premium. Please don't ever do this. Check out the costs of the $0 premium plan. How can insurance companies offer a $0 premium plan? They manipulate their formularies and tiers. As we go into plan details and drug coverage, we see that the pharmacies are all still in network, but the common brands like Lantus and Symbicort are not on the formulary and are not covered by this plan and leave you paying the cost out of pocket to the tune of almost $24,000. To repeat, if drugs are not on formulary, that $2,000 max out of pocket does not apply. Now, for those of you with no medications or you only take low-cost generic drugs, this $0 premium plan is wonderful. It keeps your costs low. Even in the example earlier in the video for the family member who had the Medicare.gov account, the $0 premium plan was the lowest. And then you keep this drug coverage and you avoid any Part D penalties because you have creditable drug coverage through this $0 plan. But as you get into higher cost brands, sometimes they are not covered well on the $0 plan. Going back to the search results, I added both plans to compare, and along the bottom you can see that we are able to compare up to 3 plans, and I'm going to add one more plan just to drive home another point. I'm going to switch it back to filter by lowest drug plus premium costs. I'm going to go down to the third lowest cost plan with a $132 per month premium and draw attention to the total overall cost being just over $2,000 for the year. In plan details and under drug coverage, all of the pharmacies are in network and all of the medications are on formulary, so why did it get above $2,000, which should be the max out of pocket? Well, the monthly premiums that you pay to have the plan do not count towards your $2,000 max out of pocket. The $2,000 limit only applies to medication costs for drugs that are on formulary and covered by your drug plan. Okay, let's wrap this up with comparing the plans and then getting enrolled. Here along the bottom, we're going to compare the 3 plans that we looked at. Premium costs are here. The deductible differences are important as well. The deductible is the dollar amount that you pay first before your plan starts to help out. The two high premium plans don't have a deductible and start helping immediately. The $0 plan has a max deductible for the 2025 year of $590. You need to pay $590 out of your pocket first towards your drug costs, and then your plan will kick in and start to cover things. Now, with most of these plans, Tier 1 generics are covered before you hit your deductible. So those low-cost drugs will be covered before you're paying that $590. We can see which plans have which medications covered on formulary. Here's our problem child plan. We can also see which pharmacy will give you the lowest costs. The pharmacy costs can change throughout the year. This is a big variable here. These prices can and do fluctuate throughout the year. So in our make-believe example here, this first plan is the lowest overall cost plan, and you can actually enroll from here. Before you do this though, this is super important. If you are already on this plan, meaning this company and this plan is the one that you have right now in 2024, and it is still the lowest cost plan for 2025, you're done. You do not need to re-enroll through Medicare.gov. Your plan will automatically renew. If this is not your current plan and you have found a different plan that is lower than your existing plan, you would click this enroll button. A box will pop up here confirming with you that you do want to actually enroll in this plan. Click join plan, and then you'll be asked to put in your Medicare number that you can find on your Medicare card. Now, this is as far as I can take you because I don't have a Medicare card for myself yet and I'm not enrolling anyone for realsies, but the process is straightforward and simple. You can see there are 7 steps and that's it. You did it. You can finish this all by yourself and you will receive your documents in the mail or via email from your new drug plan before January 1st. Remember, if you make a change, the new plan begins on January 1st. You still have your old plan through the end of the year. If you are considering moving from a standalone drug plan and a supplement plan to an Advantage plan, this is a different process. Connect with your agent around this. There's a lot more involved with that process and in that decision to consider. I hope this tutorial was helpful for you. What I think is great about this is that you see exactly what your agent or broker sees. With supplement plans or Advantage plans, there is a lot of extra data that an agent can bring in to help with that decision. With drug plans, it really is that simple. I appreciate you making it this far. There's one last little tidbit here. Get started now. Don't wait until December 7th to get this moving. Mistakes can be fixed between now and December 7th, but on December 8th, you don't have that luxury. Don't procrastinate. Happy AEP, and I will see you in the next video.